Here is scenario 3, and here is the scenario 3 evaluation. The good practice involves the risk-benefit analysis. They performed a health screening, which I will show after this slide, and they had a subject disclaimer in there before performing the research. However, the poor practice includes poor laboratory safety procedures, and this is when dealing with blood, it's crucial to wear gloves or protection to prevent cross-contamination. This is because different people have different blood types, and others might have illnesses or diseases that can be transferred. This can result, and they did this by them not switching gloves after each patient. This can result in future supervision for a long period of time of 5 years if termination of their job isn't ensued over health and safety. However, they can also get a heavy fine and a suspension along with health and safety training. There's also deception by commission. They did this by saying the lactate test would not hurt at all. However, you do feel a sharp pinch to get to get the blood out. This is deception, as they said it wouldn't hurt. However, some people may think it does, as people feel different levels of pain. Especially with younger gymnasts, they might feel more pain than a fully grown adult. This can result in the researcher getting fined and having a suspension of 2 to 3 months, and also a loss of their BASIS accreditation. Consequences to the participant include physical harm from the needle getting the lactate test, and they may also have a negative reaction to the needles or an allergic reaction due to the researcher not following safety procedures, or from cross-contamination of different blood types. Consequences to the researcher are the researcher could get fined and have their license revoked, along with termination of their job as they didn't follow a lot of mandatory health and safety rules. The corrections they need to do is they need to change pair of gloves for each gymnast as to prevent contamination and for hygiene reasons, and not doing this can lead to spread of infection and disease. And deception by commission, the researcher needs to tell the gymnast that they will feel a small prick or pinch and may get a bruised finger, so they know what's going to happen afterwards. And here's the health screen.